Good morning. Thank you for joining us this year at the 2020 Virtual Payroll and Personnel Officers Conference.
Hi, I'm Tammy Cottingham. I'm the Personnel Officer for the State Employees Insurance Board, and I would love to welcome you all to our 2020 Virtual Payroll Personnel Conference.
Hi, I'm Jeremy Darbaris with the Marketing Department at SEIB. I'm here to introduce Enrollment's Top 10.
Hey, I'm Jeannie Blake, Benefits Advisor with the State Employees Insurance Board, and today we are going to talk about new hires that decline coverage. If you have a new hire in your agency that has declined all insurance coverage, we still need to get an IBO2 active enrollment form completed. Also remember that if they do decline coverage due to the fact that they have other group health insurance, mention to them our free alternative plans. Or if you don't feel like talking to them about it, please send them to us, their benefits advisors. Thanks!
Hi, I'm Patricia Driver with State Enrollments, and I was going to talk to you a little bit about the Form 11s. We need a Form 11 anytime someone goes on leave without pay. Also, if they're a resignation, we need a Form 11. The leave without pay forms, we need it specified what type of leave without pay they're on, if they're on FMLA leave without pay, or if they're on military leave without pay, or regular leave without pay. We need that on the form. Also, if they're on 2/3 pay, we need a Form 11 for that. And then also, if you have a new employee that starts to work and they only work like a day or two and then they resign, we still need the new enrollment form completed in full. And if the person's not available for signature, we will take the payroll clerk completing it with them writing on there that the person's unavailable for signature, and then send that in to us, because we still have to enter that in the system. And then we will still need a Form 11 indicating that they have resigned. A lot of times we get the Form 11 as a resignation, but we haven't received the enrollment form yet to enter them in the system. So that's very important that we receive that.
Hey, just here to remind you to use the correct form. All of the forms are located at the seib.org website. We have them categorized by subject matter, so there's status change forms, enrollment forms, discount forms. All the different forms that you need are there with an expandable list. So if you see those, just make sure that we're getting the right one. And there's probably a screenshot right here showing the website. If not, I'm sorry.
Good morning. My name is Lasha Hampton, and I am a health insurance assistant with the State Employees Insurance Board. I'm going to speak with you briefly about the importance of making sure that your enrollment forms are legible and completed. First, we want to make sure that your employees either type in the form or fill in the form with black ink. Please make sure that they print the form, because we have to transfer that information. Also, it is very important that the employee returns the form back to you, the payroll clerk, so that you can sign off on the form. The form has to be signed off by the payroll clerk. It has to have the employee's hire date in the agency name or number, or both. If you have any questions about these forms or completing these forms, please feel free to call our office. We are here for you. We are never too busy for you. And believe it or not, we enjoy speaking with you. So just make sure that your employees know that our forms are now fillable online so that they can type those forms in. It's easier for you, and it's also easier for us. Thank you, and you have a great day.
Hey, if you can't read the forms, we can't either. If you get a form that's not legible, please have the employee refill that out for us. So if they're trying to add Cluid Jr. to their account.
Hey, it's David.
That says David? Okay, David Jr. We can get him on the account. All right, thank you so much for doing that for us.
Hi, I'm Toya Williams. I'm with the State Employees Insurance Board, the Enrollments Department, and I'm going to talk to you just a little bit about sending in your status change form. When sending in a status change form, we do require that you send in all documentations. However, if you do not have your documentations, such as your marriage certificate, birth certificates for dependents, then still go ahead and send in your status change form anyways, and then you can send your documentation as soon as you get it. However, we will send you a letter requiring that you send in that documentation, and you have 30 days from the date of that letter to do so. Reasons for sending in status change forms can be that you got married recently, that you had a new baby recently, or you even got a divorce recently. Those are imperative reasons to go ahead and send in your documentation. However, if you do not have your documentation, please send in your status change form immediately so that the process can begin. However, do take note that it is not complete until we do receive documentation. Also, if you have grandchildren, stepchildren, those documentations are required as well. With grandchildren, we do have to have custody papers. Your names are required to be listed in the custody papers. If not, you can also send in proof of relationship. Proof of relationship is that children's birth certificate and their parent, which is your child's birth certificate, to tie relationships to those children. You have 30 days from the date of your marriage to send in a status change form. You have 60 days from the date of birth to send in a change form. On your divorces, we do require that you send in those status change form as soon as your divorce is final and signed by a judge. We do require the first and the last copy of the divorce decree in order to remove the spouses from your policies. However, until you get the divorce decrees, you can go ahead and send in those status change forms immediately to notify us that your divorce is either pending or has been final. Also, status change forms can be used for changing your address. We do ask that as soon as you move to make sure that you print out one of our forms and send it in to the State Employees Insurance Board, because sometimes when you fill it out with your agency, we don't always get that status change form. Also, you can print out our status change forms from our website, which is www.alseib.org, and go under forms. All of our forms are listed there. You don't necessarily have to go through your payroll person or your human resource person to fill out a status change form. That's not needed. That is something that you can do on your own. If you want to change your email address, your phone numbers, any demographic information can be updated per a status change form. Those forms are located again on our website, www.alseib.org. That is an IB03 form. And of course, if you ever need assistance in filling out those forms, feel free to give us a call. We will be glad to walk you through how to fill that form out. If you're not sure what that form is needed for, we're here to help you with that as well. Status change forms can also be used for special qualifying events. If you have a child that has lost their job or need to come on your insurance outside of open enrollment, you can use those forms as well.
Hey y'all, my name is Mary Catherine Carlisle and I am an SEIB Benefits Advisor, and I would love to tell y'all about the discounts. Please remember to tell your employees about those discounts so you can save them money. We do have all of those discount forms on our website. They're under the forms section. Have them complete those forms and then, submit that to us with that enrollment paperwork. Also, if they are going online to enroll online, they can go to their My SEIB online account and complete those discounts that way as well. So just don't forget about the discounts. Remember to save them money because they'll love you for that. I mean, they already love you, but they'll love you even more for that.
Hi, I'm Darlene Williams. I'm the program manager for the State Employees Insurance under Enrollments. I want to talk to you today about the IB-17 form. That's the Reemployed State Retiree Working Health Insurance form. You would use this form if you hire an employee who is retired from the state of Alabama, from a state agency is what you would use this form for. If they are a retiree and it's not from a state agency, you do not use this form. This form is also used if they work 10 to 29 hours per week on average. And the forms are listed under our form section, and the retiree form 7 IB 17. There's also under that same section is listed as more information. We have a memo that will give you a lot of information on also when to use this form. So you can click on that and receive this memo and read this memo. If the employee that you are hiring is Medicare eligible and retired, then those Medicare eligible retirees, their benefits will change because we have to convert them to primary coverage. And anyone on the contract that's Medicare eligible, once we claim this retiree as a retiree working, their benefits change. They have to be converted to primary coverage. We would bill the state agency for this primary premium for the retiree, but the retiree pays the dependents premiums out of their retirement benefit check. If the retiree works 30 or more hours on average per week, then you would use an IBO2, an active enrollment form. And we would actually claim those retirees as an active state employee for insurance purposes. The agency would pay $930 per month, and we would bill the agency for that premium. And this is just for insurance purposes that we would claim them. We ask that you let us know when the retiree is no longer working, so that we can change them back. If they are Medicare, we can change them back to the Medicare Advantage product that they were in. And we just ask that you let us know, and we thank you for helping us. If you have any questions on a retiree working that you're thinking about hiring, just give us a call. We'd be glad to help you.
Oh, hey there. I was just filling out ye old enrollment form for wooden teeth insurance. Well, I see this hasn't been available since George Washington was president. So you might have a stack of about 500 of these sitting around. So what do we do with all of these old enrollment forms? Well, we can decorate the office. We can make paper airplanes with them. Or we could just recycle them. But please do not give them to employees to enroll with them.
Thank you for attending the 2020 Payroll and Personnel Officers Conference this year. I want to thank you for your assistance that you have given us through the years to help us process enrollments by answering all the many calls and emails that we send to you. By you answering these in a timely manner, it helps us to process the applications quickly so that our state employees can access their health benefits quicker. Thank you.
There are no premium, deductible, or copayment changes for 2021. Grace periods for all discounts and waivers are 60 days from the enrollment date. This is an enhanced benefit for members since previously it was based off of the hire date. So members who initially declined coverage or coming back to coverage will now have a 60-day grace period from their enrollment date. At this time, we are also allowing 90 days for the wellness discount. There are no changes to the flexible spending account annual contribution amounts at the present time. The maximum contribution amount for the health care reimbursement account is $2,750. The maximum contribution amount for the dependent care reimbursement account is $5,000. In the event that the IRS increases the maximum contribution amount before the beginning of the plan year, members choosing the maximum healthcare reimbursement account annual contribution can elect to increase their annual contribution by indicating that on their enrollment form. There are two major changes to the healthcare reimbursement account this year. The first one is an expanded list of eligible expenses. You can view those at www.connectyourcare.com. The second change is the rollover amount for the healthcare reimbursement account has changed from $500 to $550. Due to the pandemic and resulting child care closures, there will be a 2.5-month grace period allowed in the 2021 plan year only. This grace period will allow you to use unused 2020 dependent care reimbursement account funds. The employee must be in active status on December 31st of 2020 to be eligible. Claims will be paid out of the unused funds first until the funds are exhausted or the grace period ends, whichever occurs first. Available balances can be used for 2020 and 2021 eligible expenses through March 15th of 2021. Claims must be filed by March 31st of 2021 or the unused funds from 2020 will be forfeited. New services for 2021. The Wellness Discount Verification System. It's available now. Subscribers can call 334-263-8454 or toll free at 866-841-9489 to check the status of their wellness discount or that of their spouse if they have one covered on their account. Text reminders for upcoming deadlines will be a new service that you may opt into. Also, a new employee online enrollment system is coming soon, and an interactive map with individual landing pages for benefit advisors is coming soon.
Hi, this is Carrie Schlenker with the State Employees Insurance. I'm the benefits advisor for North Alabama. Today we're going to cover the State Employees Insurance Board health coverages. Most companies, they either offer you their insurance and you can take it or you don't take it. With State Employees Insurance Board, there's several options for you to consider. We've got the State Employees Health Insurance Plan, CHIP, S-E-H-I-P. The medical is administered by Blue Cross, and our pharmacy coverage is with Optum RX. Or you've got the option of the supplemental plan administered by Blue Cross Blue Shield. Or the premium cash option administered by Connect Your Care, CYC. We also have the optional plan administered by Southland Benefit Solutions. We just call that Southland. Members are only eligible to enroll in only one SEIB health coverage option. State Employees Health Insurance Plan, CHIP, S-E-H-I-P. This is the medical coverage that we have with Blue Cross and the prescription coverage with Optum RX. There are costs to the employee for this benefit. It has monthly premiums, co-pays, co-insurance, and deductibles, plus additional charges that can be incurred are the spousal surcharge, gaps in care, wellness, tobacco premiums. But there are discounts and waivers that are available. CHIP discounts and waivers. The first discount we have is the non-tobacco user discount. This is Form IB05 on the State Employees Insurance Board website under Forms. In order to get this discount, you have to be 12 consecutive months tobacco-free. In completion of the form, please make sure you put the email address in. We try to update all our information. Underneath that, there's two little boxes a lot of employees forget to complete. Make sure the appropriate boxes are marked. The employee is the contract holder. They're going to sign the next two signature lines, and the last signature line is the spouse, if they're being added to the coverage. This is a $60 discount for the member and for their spouse, if their spouse is on our insurance. You can also go to the State Employees Insurance Board website, and after login on my.alseib.org, you can actually complete this discount online. Spousal surcharge waiver. This is Form IB-25 on the State Employees Insurance Board website. This form is only used when the employee is adding their spouse to the Blue Cross medical coverage with the state. For example, say that spouse is working, but they're not offered insurance. Or maybe they're offered insurance and their medical premium with that company for single coverage is more than $255 a month. Those are reasons to complete this form and get the $50 spousal surcharge waiver. Or maybe that spouse is unemployed, retired, disabled, or self-employed. Those are also reasons to complete the form to get the $50 spousal surcharge waiver. An example would be if you elected the first one, the spouse's premiums are more than $255. To the far right of that, there's a request for additional information. They want a letter from the employer stating how much the individual premium is under their coverage. Gaps in care premium discount. There's no forms for this discount. They're claims-based. Blue Cross identifies the gaps in care. You can go to the Blue Cross website, and after a login, you can look for care reminders. This is your way to avoid additional $25 premium for the member and a spouse if they're on their insurance per month. FPL premium discount. This is the federal poverty level premium discount. It's Form IB-12 on the State Employees Insurance Board website. This discount is based on total income and household size reported on your federal income tax return from the previous year. The discount can give you anywhere from 10 to 50% off on your monthly medical premium with the State Employees Insurance Board. This application's new for this year. It's a one-page application. You fill out the top section. The next paragraph tells you to go to the IRS website or call the IRS and get your tax transcripts to go with the application. Your tax transcript are a nice, clean, typed version of your taxes from the previous year. You put that with this application and you send it to the State Employees Insurance Board. You can fax it or email it, but you're sending it to the accounting department directly. You don't have to send this through anyone else at your office. This is personal information. Send it directly to the accounting department. Discounts and waivers. All discounts and waivers are prospective and can be earned the first day of the second month after SEIB receives the missing information if you miss the deadline. In other words, if you miss the deadline, get the information in as soon as you can. It can still be applied. Refunds are not given for failure to timely submit appropriate information by the deadline. You can visit the website at www.alseib.org to create a MySeib account to verify your discount online or call SEIB at 866-836-9737 or call your benefits advisor. We don't mind helping. Spousal surcharge waiver application and documentation requirements are available on our website under the Forms link. Federal poverty level, that's the FPL application, and federal income tax transcripts must be submitted directly to the SEIB accounting department. CHIP premiums. Monthly premiums for a single employee with medical coverage, that's $115 a month before the discounts. If they've got family coverage without the spouse on there, they're paying $305 per month before the discounts. If they've got family coverage with a spouse, they're paying $440 a month for their medical coverage prior to the discounts. Take off for the non-tobacco user, the wellness, the spousal surcharge. That individual premium went to $30 per month for their medical coverage. For that employee that had family without the spouse, they went to $220 per month for their medical. For the employee that had family coverage with the spouse, after those discounts were applied, they're down to $220 a month for their medical. Of course, this doesn't take into consideration the federal poverty level discount and the gaps in care premium. Standalone policies. State Employees Insurance Board has two standalone dental coverages to choose from. The Blue Cross individual dental policy is $8 per month, annual benefit of $1,500 per year. Preventative services are covered at 100%. Basic and major services, fillings, crowns, bridge work, covered at 50% after a $25 annual deductible. There's no orthodontics coverage on the Blue Cross individual policy. The Southland individual policy, again, is $8 per month, has a maximum annual benefit of $1,250 per year. Preventative services, 100%. Basic and major services are covered at 80%, no deductible. So it leaves you with less liability than the Blue Cross coverage. Again, there's no orthodontics coverage for the Southland individual policy. The Blue Cross family coverage, that's $15 per month, maximum annual benefit of $1,500 per member. Preventative services are covered at 100%. Basic and major services, fillings, crowns, bridge work, covered at 50% after a $25 annual deductible. But this is what's nice about the Blue Cross family coverage. It has $1,000 for lifetime maximum for orthodontics for children up to the age of 19. If you've got a child that's on Medicaid or all kids, you can add them in November in open enrollment to your state dental if you've got the Blue Cross plan, and they'd have $1,000 towards their orthodontics. It wouldn't interfere with their Medicaid or their all kids. That's paid out over the course of 12 months. It's not all paid at one time. Now, the Southland family dental is $15 a month, maximum annual benefit of $1,000 per member. So this goes down quite a bit from what the Blue Cross is. The Blue Cross family coverage is at $1,500 per member. The Southland now is under the family coverage is $1,000 per member. Preventative services, again, covered at 100%. Basic and major services, again, the fillings, crowns, things like that, covered at 60% after a $25 annual deductible. And the Southland family dental coverage does not carry orthodontics. Other standalone policies. Southland cancer policy. I've been in insurance a long time. I've never seen a cancer policy that waived pre-existing. This one does. You can sign up for this policy any time of the year. It starts the first day of the next month. It does not matter if you've already been diagnosed. It pays. It pays regardless of other coverages you've already got in place. It's $12 a month for single coverage, $24 a month for family coverage. This is for active or retirees. Southland Vision Policy provides either contacts or lenses and frames, but not both in any plan year. It pays $150 per eye benefit for refractive surgery, $12 per month for single coverage, or $24 per month for family coverage. You can sign up anytime. It starts the first day of the next month. With either of these policies, you can get out of the policy in November in our open enrollment after being in the policy for 12 months, and the benefit would discontinue January 1st of the next year. Free benefit options. Options for members with other group health insurance. Other group health insurance can be offered through a spouse, a parent, if employee is under the age of 26, or another employer. Members can enroll in only one. I have to chuckle here because I have a lot of employees that try to enroll in several. Supplemental plan. This is kind of my favorite. I was on my husband's insurance for 9 years until he retired. During that time, in lieu of state medical, I carried the supplemental plan. Doesn't cost anything, it was free, but it covered my husband and myself. It eliminates most copays, coinsurances, and deductibles when your primary coverage does not pay 100%. Well, I can tell you firsthand, I was on it for 9 years, and for 9 years I had no medical expense, nor did my husband. Primary insurance deductibles cannot exceed $1,400 for single and $2,800 for family coverage. Plans are free for single or family coverage. Excludes government plans such as Medicare, PHIP, TRICARE, TRICARE for Life. Talk with your advisor. Each county is assigned an advisor, a benefits advisor with State Employees Insurance Board. Let us help you look and compare your policies. We'll help you keep the most money in your pocket. Premium cash option. I've got a lot of folks in my territory that are taking advantage of this benefit. The premium cash option reimburses you up to $175 per month, tax-free, based on the primary coverage premium. Say you're on a spouse's insurance where they work and you want to stay there. Well, okay, sign up for the premium cash option. It's not insurance, it's reimbursement. If your spouse's insurance premium is $100 a month, you get reimbursed $100 a month. Now, if their premium is $175 or more each month for family coverage, you can get $175 reimbursed back to you each month. Awesome benefit. Say you're on your parents' coverage. I've got a lot of young employees that are under the age of 26 that are still on their parents' coverage. If your parent keeps you on their coverage, you can sign up for the premium cash option. It's not insurance again, but it's money, it's reimbursement. You can actually get reimbursed up to $175 a month based on what your parents are paying for coverage. Awesome benefit, y'all. The reimbursement can be mailed directly to the member or direct deposited into a checking or savings account. Your account can be viewed and claims made by using the My CYC mobile app or on the connectyourcare.com website. You can also contact Connect Your Care 24 hours a day by phone. If you have the opportunity to be on other coverage, the state is offering these benefits, and they're awesome benefits. If you've got questions, please contact your benefits advisor. Optional plan. This is in lieu of your state medical coverage if you have other insurance available somewhere else. This gives you 4 benefits in one. You've got a dental, a vision, a cancer, and a hospital indemnity policy. Hospital indemnity policies pay you so much per day for hospital stays. The dental and the vision coordinate with other policies. The cancer and the hospital indemnity pay regardless of your other coverages. When you sign up for this policy, you have to stay in it for a minimum of 12 months. You can come out of this policy in our open enrollment in November with a January 1st effective date. With all these plans and benefits that we've gone over, if you have questions, please contact your benefits advisor. That's what we're here for, to help you keep money in your pocket. And these are all options to be able to do that. Thank you for your time today. Have a great day.
The Wellness Program is a voluntary program that is designed to help members and their covered spouses stay aware of their physical condition. The Wellness Program includes screenings for risk factors, physician referrals, monitoring for gaps in care, and other free resources and programs. During the screening, the following areas are assessed: blood pressure, cholesterol, glucose, and body mass index. If determined at risk, the member will receive a physician referral form for follow-up. The screening is not complete until there has been follow-up on the risk factor. Please visit www.alseib.org for completion alternatives. As mentioned before, the Wellness Program is voluntary. However, certain members are required to participate to receive the wellness discount. Who is required to participate? Active members, non-Medicare retirees, and their covered spouses in the CHIP group 13,000. Who is not required to participate? Medicare eligible retirees and their Medicare eligible covered spouses, dependent children, and members enrolled in the SEIB plan other than the CHIP group 13,000. What is required? An annual wellness screening. This must be completed before October 31st to avoid the wellness premium. If risk factors are identified during the wellness screening, follow-up is required to complete this activity. Where can I get screened? At the work site, county health departments, the state wellness center, pharmacies, and your healthcare provider. Please visit www.alseib.org for a list of participating pharmacies. The Gaps in Care program is designed to identify certain national standards of care that should be completed in order to support your overall health. To close the gap or have the test that has not been identified by claims needs to be done by October 31st of the year that you're identified to avoid a $25 monthly premium. Categories currently being monitored are diabetes with the HbA1c test and eye exams, breast cancer, cervical cancer, and colon cancer. Some free resources and programs available through the Wellness Program are discounts at select exercise facilities, physician supervised weight loss program, nutritional counseling program, tobacco cessation program, and Baby Yourself maternity program.
Hello, my name is Lisa Reeves, and I am the nurse administrator for the State Employees Insurance Board. I am here today to tell you about our new Achieve Wellness program. The SEIB has been screening for risk factors for years, but now it is more important than ever to prevent, delay, manage, or even reverse chronic diseases. Individuals with one or more chronic diseases are more likely to suffer from the effects of COVID-19 than those with few or no health conditions. We understand your concerns and are doing something about it. The SEIB will begin offering several wellness initiatives to help you become the healthiest you that you can be. We are offering programs to address diabetes, weight loss, hypertension, and much more. The first we'll discuss is Virta Health. Virta Health is a treatment that reverses type 2 diabetes. Virta can help you lower your blood sugar, A1C, and weight without the risk, cost, or side effects of medications or surgery. Virta uses the research-backed combination of nutritional ketosis, medical supervision, and one-on-one health coaching. Some of the things that you get with Virta are continuous physician supervision, individual treatment plans, tools for biomarker tracking, such as testing strips and scales, personal health coach to answer questions and provide support, on-demand resources such as recipes, meal plans, and educational guides, and a private Virta Health community to connect with others. Now we'll look at a short video to tell you more about Virta.
They told me I'd follow in my mother's footsteps. She died young from diabetes. That terrified me.
I was in constant pain, especially in my feet. I didn't know if I was going to be able to carry on doing my job with the pain that I was suffering from.
I was diagnosed at 27 with diabetes, and shortly after that, I was put on insulin. For me, that was scary.
They told me the best way to help my patients was to prescribe more medication. We see their health getting worse. There has to be a better way.
They tell us all these things about what living with diabetes is all about.
What living with diabetes means.
But they're not true.
With the current standard of care, or just managing disease, there's a real solution for this epidemic, and people should know about it.
My job is to provide benefits and save the company money. I now have a life-changing solution for our employees and their families.
I'm not on insulin anymore, and it's a very big deal. Can't wait to see what's next.
I'm better at my job than I was 10 years ago. I don't deal with the constant pain, and I'm putting the young guys to shame.
So now I'm keeping up with my grandsons, and I'm eager to see what life has in store for me. I got teared up.
The next program is Naturally Slim. Naturally Slim is an online weight loss program that teaches healthy habits leading to sustained less stress, better sleep, and more, all with no restrictive diets, no calorie counting, and no specialty foods required. How it works? You will learn to change when and how you eat, not what you eat, to improve your overall physical and emotional health while eating the foods you love. Plus, Naturally Slim is clinically proven to help lower blood pressure, blood sugar, and triglycerides to help participants reduce the risk of developing diabetes and heart disease. Participants who remained in the Naturally Slim program during 10 weeks lost an average up to 10 pounds, increased their confidence, and increased energy. We now have a short video to tell you more about the Naturally Slim program.
Now, more than ever, is a great time for Alabama state employees to invest in their health, both their physical and emotional health, and the State Employees Insurance Board is making it easy. Over the past few years, hundreds of thousands of state government employees from around the country have lost weight and dramatically improved their health and quality of life through the Naturally Slim program. And now you too can take advantage of the most effective digital health improvement solution in the country. Naturally Slim will help you lose weight. That's just what happens. But that's also just the beginning. In addition to losing weight and keeping it off without dieting, participants show measurable improvements in metabolic health, physical activity, energy, mood, and overall emotional well-being.
What I like to tell people is that I've done this, losing the weight and getting my life back without having any surgery, no pills, and it's not a diet. It's just a lifestyle change.
The things that I've gained because I'm healthier, because I have more energy, are things like being able to play with my kids, to have energy for my wife. Those intangibles, you don't ever read about those in a weight loss brochure.
Besides an MD, dietitian, and physical activity expert, the Naturally Slim teaching team includes 3 psychologists who will help you build skills to improve your sleep, increase resilience, and lower your stress. And best of all, it's all done through technology, using your phone, tablet, or computer.
I was skeptical, didn't see how it would work, but once you start watching the videos and learning all the tools to use, yes, it works.
I just got my old self back, really. Just listening to my body, it was so easy.
It totally changed my perception of how I saw food.
Not just about the food and the eating, it's about taking care of myself, and that's been a huge, huge change for me.
I have more energy, more confidence, less pain every day when you get up. You feel better, and you just can't put a price on that.
With what's going on now with the pandemic, then this could have been a time I easily could have crashed and burned and went back to my old eating habits.
You might not know if it'll work, but you don't know that it won't. So, you have to just give it a try. And once you give it a try, then you'll see the results for yourself.
I think that no matter who you are, no matter where you are, no matter how much hope you have lost in this battle, try this one more thing. It will be the last thing you have to do.
Your journey to improved health can begin soon. Naturally Slim is offered at no charge to eligible subscribers and spouses enrolled in the State Employees Health Insurance Plan administered by Blue Cross Blue Shield of Alabama. To sign up or learn more, simply visit naturallyslim.com/SEHIP.
The third and final program is My Blue Health, a personal care team provided by Blue Cross Blue Shield. Blue Cross and Blue Shield of Alabama is constantly looking for ways to better serve our members. We are excited to offer an enhanced program that provides you a personal care team. As a member, you will receive personalized help making positive lifestyle choices such as eating healthier, exercising regularly, and taking medications as prescribed. What's included in My Blue Health? Advocacy helps you locate a doctor or specialist, schedules appointments for you, explains your benefits, addresses your questions and problems, and researches issues concerning your healthcare needs. Chronic condition management is telephone-based support for members with asthma, coronary artery disease, chronic obstructive pulmonary disease or COPD, diabetes, and heart failure. Health coaching offers support for conditions such as hypertension, hyperlipidemia, obesity, and prediabetes. Your team consists of specialists such as registered nurses, health coaches, registered dietitians, pharmacists, licensed social workers. To recap, these programs are completely voluntary, but we encourage you to take advantage of one of them. This rich benefit is offered at no cost to you as a valued member. It is presently offered to subscribers and their spouses. Please look for more information on our website at www.alseib.org. Thank you.
Hey, I'm Jeannie Blake. I am a C Benefits Advisor for part of Montgomery in Southeast Alabama. Today, I'm going to talk to you a little bit about Teladoc. Teladoc is available to our members who are enrolled in the CHIP plan group 13,000. This is an app that gives you free access to physicians 24/7 by phone and of course by the app. When to use Teladoc? When your schedule doesn't permit an appointment. If your primary care doctor or your child's pediatrician is unavailable. If your kids are anything like mine, they get sick on Friday nights and Sunday afternoons. You can also use Teladoc if you're out of town. Say you forget your blood pressure medicine. You can call up Teladoc, tell them you need a supply to get you through while you're out of town, and they can get it called into a convenient pharmacy near you. And then of course if you live in a rural area. This service is not for emergency care. If you have an accident, please go to the nearest emergency room or call 911. Do not call Teladoc. How does Teladoc work? First, you can download the app and register, or you can use your desktop. But you'll want to go ahead and register yourself on the app. If you and your spouse are both enrolled in the group 13,000, y'all will need to have different accounts, as well as dependents who are over the age of 18 due to HIPAA privacy reasons. After you've gotten everything downloaded and registered, you'll request a visit. Super easy. Then you'll have your visit. You can talk to them over the phone. You can FaceTime them. You can also send the doctors pictures. And then hopefully your problem will be resolved, and if a medication is needed, they can send it to your pharmacy of your choosing. Conditions Teladoc treats. Some of the top diagnoses that we get on Teladoc is cough and cold, allergies. We do live in Alabama. If you have skin issues, like say you've got a rash or something on your arm, that's one of the ways that you can take a picture of it and send it to the doctors we were talking about previously. Pink eye. If y'all have children, you know that pink eye is something that runs rampant in daycare. So I'm so thankful I can call Teladoc. I can show them a picture of my child's eye. They can give me drops for pink eye instead of having to take them into the urgent care where they catch the flu just when we're trying to treat pink eye. And then, of course, Teladoc is not going to treat any pain, any chronic pain or anything like that. So please do not call them, for any kind of backaches or anything. Also, they are not going to call in any hydrocodone cough syrup. If you've got a cough that's that serious, you're going to have to take a visit to the doctor. This is just basic things that Teladoc treats.
Hello, everyone. My name is Rick Wedges. I'm the Benefits Advisor for Central Alabama for the State Employees Insurance Board. We're going to talk a little bit about flex spending plans today. All right, let's start with the first slide. Okay, we're going to talk about reimbursement accounts. The first one is a healthcare reimbursement account, commonly called the HCRA. What this account is designed to do is cover things like co-pays, co-insurance deductibles, and things that our medical insurance normally does not cover. The minimum amount of money you can put into this account is $120 per year. That's $24 a pay period. The maximum amount of money you can put in this account is $2,750 a year. That's $110.50 a pay period. There is a rollover provision, and that's where there's been a change this year. It allowed us to move up to being able to roll over $550 instead of $500 from last year. In order to be able to roll money over, you must participate in the flex spending account the following year. SEIB, as always, gives everyone $50 free for enrolling in the HRA plan. Okay, the slide that is up now shows you a comparison between someone who spends $2,000 a year on copays and medical expenses with an HCRA and someone who spends $2,000 a year on copays and medical expenses without an HCRA. On the bottom right hand of the slide, you'll see that the person that does have the HCRA ends up saving an average of $453 over that year time period. Okay, the next slide is talking about dependent care reimbursement accounts. That's things like daycare expenses for children and the elderly. The maximum contribution that you can put into one of these accounts a year is $5,000. You must submit receipts from the daycare provider and have to be reimbursed for that amount of money. You can either be reimbursed with a check through mail, or you can have it directly deposited into your checking or savings account. There is no rollover provision for this money. So my advice to everyone, if you're going to use this, is make certain sure that is the amount of child care that you're going to use that year, because if not, you will lose that money.
There will be a dependent care reimbursement account grace period for the 2021 plan year only. To reiterate what Rick just said, this is not a rollover. The funds will only be available for a limited time. Unused 2020 dependent care reimbursement account funds must be used by March 15th of 2021. Funds can be used for both 2020 and 2021 eligible expenses through March 15th of 2021. Claims must be filed by March 31st of 2021, or the unused funds will be forfeited. This does not affect your 2021 annual contributions amount. This amount is just a grace period to spend down any unused funds from the previous year due to child care closures because of the pandemic. Now back to Rick.
This slide shows a comparison between someone who uses a DCRA savings account and someone who does not, with the amount of child care or elderly care being at $5,000 per year. As you can see on the bottom right-hand side of the slide, the person that does use that saves $1,132.50 over the person that elects not to use the dependent care reimbursement account. Okay, on this slide, we're going to talk about how we receive reimbursement for our accounts. On the HCRA, there's a couple of different ways. The first one is called the manual reimbursement, and it allows you to fill out a form and send in to our administrator, Connect Your Care, and you receive a check back, or it allows them to deposit it directly into your banking or savings account. The other method is called the Flex Card. Every employee that signs up for an HCRA gets a Flex spending card in the mail. This is a preloaded debit card with the amount of money you elect to set in your account for that year on it. If you're going to use the card, please be sure and keep your receipts, as Connect Your Care may require you to send them proof of that receipt. Okay, on the dependent care reimbursement account, the only way that you can be reimbursed is through the manual method, meaning you have to fill out a form and send it to Connect Your Care. They, at that point in time, can either cut a check and send it back to you, or they can direct deposit the amount that you have spent into your checking or savings account at the bank. All right, the next slide talks about the reimbursement procedures. On the manual, reimbursements can be submitted using any of the following options: the Connect Your Care mobile app, the Connect Your Care website, or a paper claim form. You can either fax it or mail it. It reminds you again to keep your itemized receipts. If you need some more information, please visit our website at www.alseib.org.
Hey y'all, this is Mary Catherine Carlisle. I am a benefits advisor for the SEIB. Let's go ahead and dive in and take a look at your health insurance benefits at retirement. First up, let's take a look and see who is eligible for SEIB health coverage in retirement. So for the purposes of the RSA, they have their own guidelines and qualifications for who can draw retirement. Well, we're a lot the same with that. We look at your years of credible coverage. So you must have 10 years of credible coverage with the SEIB or PHIP. Something to keep in mind here. Years of service does not always equal years of credible coverage. You need to be sure you're looking at the period of time that you are eligible for insurance coverage, again, either with the SEIB or with PHIP. Now let's look at our health insurance coverage options in retirement. First up, we have the State Employees Health Insurance Plan, better known as CHIP. That's probably what you have right now as an active state employee with no other group health insurance available to you. So it's very much the same in retirement. Before you're Medicare eligible, you'll continue to have CHIP. Once you are Medicare eligible, you can do the Medicare Advantage plan. So this is the hospital, medical, and pharmacy benefit that's currently administered by United Healthcare. You must be enrolled in Parts A and B of Medicare to have this coverage. Finally, you also have free plans available in retirement for those with other group health insurance coverage. Those are the supplemental plan and the optional plan. We'll talk more about these in more detail in just a bit. You may be wondering what changes with your benefits in retirement. Well, for one thing, your health insurance premiums might vary. Those are actually going to be subject to the retiree sliding scale. There's also a Medicare requirement for those that are Medicare eligible. You again must have Parts A and B of Medicare in order to have the Medicare Advantage plan. Members that are already Medicare eligible must be enrolled in Parts A and B of Medicare and have effective coverage beginning day one of their retirement. This is also true for any Medicare eligible spouses or dependents. Failure to enroll in Parts A and B of Medicare will automatically cancel your SEIB health coverage at retirement or at the time of Medicare eligibility. Federal law only allows for members to be enrolled in one Medicare Advantage plan and one Part D prescription benefit plan at a time. If you enroll in another Medicare Advantage plan or another Part D plan, that will actually cancel your coverage that you have offered to you through the SEIB. A retiree can only re-enroll in the SEIB's Medicare Advantage and Part D plans during open enrollment if their coverage was canceled. You are still offered discounts as a retiree. Retirees and covered spouses on the Medicare Advantage plan do not have wellness or the gap in care requirements. The supplemental plan is free to non-Medicare retirees and their non-Medicare dependents with other group health insurance covered through a spouse or another employer. Something that does change in retirement, the premium cash option or PCO is no longer available. The PCO is only available to active employees. Something else that sadly does go away in retirement is the flexible benefits plan. This is something else that is only available to our active employees. And also something to keep in mind, SEIB members are eligible to enroll in only one health insurance plan at a time. In order to have one of those free plans, either the supplemental or the optional plan, you must have other group health insurance or OGHI that is not provided by the SEIB to qualify for the free plans. If you're planning on going to work for another employer once you retire from the state, keep in mind that you must take that employer's insurance if the employer contributes 50% or more toward the health insurance premium for single coverage. Spouses must have Medicare Part A and B regardless of their employment status if they are Medicare eligible and on your retired employee contract. If you have any questions about this, just be sure to give your SEIB advisor a call for more information on these free plans, and we'll be glad to assist you. Now let's take a look at how we determine your premium in retirement. There are two components to our retiree sliding scale. The sliding scale is how we determine how much you'll pay for your health insurance. Employees retired on or after January 1st, 2012 have a premium based on years of credible coverage in the CHIP. Employees retired on or after January 1st, 2012 without Medicare Their premium is based on years of credible coverage in the CHIP and their age at retirement. The first component of our retiree sliding scale is years. Years of service does not always equal years of credible coverage. I know I said that earlier, but I'm repeating it again because it's super important. Insurance is calculated on years of credible coverage, whereas retirement is calculated on years of service. Here's an example. An employee who works or worked for a local government entity that participates in the ERS may not be able to use those years of service to credit toward their SEIB premium. Here is an example of the years component of the retiree sliding scale. You can see that there is a 4% increase for every year under 25 years of credible coverage that you have. The opposite is also true. You'll see a 2% decrease for every year of service over 25 years that you have. The second component of our retiree sliding scale is age. Now, when we say age, we are always going to be referring to the age you are or were when you retired. That is not going to change. That component of the retiree sliding scale age will actually stay the same even like the older you get. So that is not going to drop off until you become Medicare eligible. Your premium will be calculated on your age at retirement until you're Medicare eligible. The age impact does not lessen as you advance in age. Here's an example of that. 2 state employees at ages 60 and 62 retire with 25 years of credible coverage with the same coverage. The 60-year-old will pay 2% more than the 62-year-old for the same coverage until they reach Medicare eligibility. Here is a visual example of the age component of our retiree sliding scale. There is a 1% increase for every year younger than 65 that you are at the time of your retirement. Remember, Medicare eliminates the age component of the retiree sliding scale. The SEIB must be notified if a member or their covered dependent becomes Medicare eligible prior to age 65. Some reasons for early eligibility include disability or end-stage renal disease. You can calculate your retiree premium online all by yourself at alseib.org. We have a retiree premium calculator, and you can input your general information, things like age at time of retirement and whether or not you're a tobacco user, and get an estimate of what your retiree premium will be. Surviving spouse coverage is available if the spouse is covered as a dependent at the time of your passing. If the surviving spouse declines continuation of SEIB coverage, they will not be eligible to return to SEIB coverage at a later date. And we have the rates listed here for both the non-Medicare surviving spouse and the Medicare surviving spouse. Remember, these are base rates before discounts are applied.
Thank you again for attending this year's conference. There's just a few things we'd like to remind you before we go. Important dates. Open enrollment is from November 1st through 30th. That's when members can make plan changes, status changes, and they can enroll or re-enroll in flexible benefits. Also, the wellness discount deadline is October 31st. New enrollees have 90 days after enrollment. The gaps in care premium discount is also October 31st, and that needs to be completed the year in which it was identified. If you would like to contact us at the State Employees Insurance Board, you can do so by mail at Post Office Box 304900, Montgomery, Alabama 36130-4900, online at www.alseib.org, or by phone at 334-263-8300, or toll free at 1-866-836-9737. As you can see from the map, there's a benefit advisor designated for your area. Please contact Carrie Schlinker for North Alabama, Rick Wages for Central Alabama, Mary Catherine Carlisle for Southwest Alabama, Jeannie Blake for Southeast Alabama. If you're located in Montgomery County, please visit our website at www.alseib.org to determine your agency's designated advisor. Thank you for attending. If you have any questions, please email us at info@alseib.org. Have a nice day.